4 million adults every year in the US are diagnosed with fibromyalgia, and 30% of them are suffering from major depression. But we are not going to let that stop us. Hi, I'm Dr. Missimer. I'm a functional medicine practitioner, doctor of physical therapy, and registered dietitian. And today we are going to talk about how to diagnose fibromyalgia. What are the underlying causes and risk factors? What are the symptoms? And most importantly, how can you treat it? So first, I'd like to tell you a little bit about Diane. Diane came to me with chronic pain, a diagnosis of fibromyalgia. She had a history of Lyme disease, and she had experienced significant trauma in her life. And she was experiencing significant pain that was debilitating. When she was going to sleep at night, she would feel this excruciating pain simply from the sheet. And when she came to me, we looked at all of her lifestyle factors. So her stress levels, her movement and relationships, her nutrition. We, of course, did testing to look at her stool tests. So we used a GI map test and found that there was dysbiosis, there was inflammatory markers. There was things that were contributing to poor nutrient absorption and systemic inflammation. Not only that, she had significantly poor nutrient intake. So when we did a nutrient analysis and also tested through biomarkers, we saw that she was not only not getting those nutrients in, but also having issues with absorption. So once we began to really address all of her lifestyle factors, including nutrition, sleep, regulating stress, and working on resiliency, and being able to, of course, address some of the underlying factors like inflammation, we were able to get her to a point where she was able to go to sleep at night and be able to sleep in her bed without having significant pain. So what is fibromyalgia? Fibromyalgia is a widespread pain disorder, and it can cause significant physical distress as well as emotional distress. It causes widespread tenderness throughout the body. So even something as simple as the example of Diane with the sheets touching her skin could cause potentially excruciating pain. It can cause sleep problems, brain fog, memory problems, fatigue, and is typically a chronic disorder. People with fibromyalgia often experience what's called allodynia. So they have an increased sensitivity to pain. So if we think of pain as it relates to nociception, if we were going to place our hand on a hot stove, we would get information to our brain, specifically in the insular region of the brain, that is going to process that pain. And so that we are going to have a motor response to pull our fingers back. In the case of fibromyalgia, unfortunately, we have this heightened sense of pain. So even something as simple as sheets can cause excruciating pain, pressure on the body, even things like light massage, light touch, all of those can create this increased heightened sense of pain. I like to think of it as the volume is dialed up versus being at a normal level. So as I mentioned, the CDC estimates that 4 million people in the US have fibromyalgia, and women are affected more than men. It can affect any age, but it often will start in middle age. And the pain can actually increase as you age. Although fibromyalgia can run in families, it is also found in many individuals that there is no genetic marker. So what are the symptoms of fibromyalgia? As I mentioned, it's a widespread pain. So this can be tissue pain. You can also have muscle aches and joint aches. It can cause fatigue, depression, and anxiety are definitely an aspect of fibromyalgia. There's often some cognitive symptoms, things like problems with thinking and memory, brain fog. A lot of people will also complain of a stiffness all over their body. Additionally, many patients will also complain of neurological symptoms, so tingling in their hands, their feet, and sometimes even a little bit more widespread where it's hard for them to explain exactly what they're feeling. And of course, there's often digestive issues associated with fibromyalgia as well. So things like bloating, constipation, diarrhea, any of your IBS type symptoms, as well as even abdominal pain as it relates to some visceral pain, where we process our pain, as I mentioned earlier, in the insular cortex, is where we have a lot of interoceptive, our internal awareness of self. Those are those interoceptors that are in our viscera, are also providing information to the brain. So not only are we detecting pain, but it's affecting us emotionally, and it's providing this information from our viscera to our brain. So that's why you'll see a lot of abdominal pain associated with this as well. So what causes fibromyalgia? Although this is quite complex to answer, there was a study done by the International Journal of Molecular Medicine on the pathogenesis of fibromyalgia. So in essence, as I mentioned earlier, there's an increase in the excitatory neurons giving our brain feedback that there is pain. There's a decrease in what we refer to as the anti-nociceptive, i.e. pain receptors. There's increase in endogenous opioids, and there's a dopamine dysregulation. So this combination of all these things creates a significant dysregulation in how we are processing pain. Oftentimes, fibromyalgia is triggered by some type of emotional or physical trauma, although it is not always consistent among everyone that is diagnosed with fibromyalgia. There are other underlying diseases that are associated with it, such as autoimmune diseases like lupus, rheumatoid arthritis, ankylosing spondylitis, depression, anxiety, chronic pain, and irritable bowel syndrome. So how do we diagnose fibromyalgia? So typically, a rheumatologist is going to diagnose fibromyalgia using specific pain points on the body. So if you have 11 out of 18 positive tender points on your body, then this is often characterized as the diagnosis of fibromyalgia. Looking at an omega-3, omega-6 profile could be really valuable. This is very important as it relates to regulating inflammation. It's also important for membrane health, and it is also important in mineral absorption. And lastly is low calcium. Low calcium can affect lots of different symptoms, as well as, of course, bone density, which we're most familiar with. So this is something that can be important in testing as well. In addition to that, just like always, we want to make sure we're looking at the underlying potential causes of fibromyalgia. So just like Diane, we are going to want to look at a wide variety of things such as micronutrients, gut testing, and so on. Rupa Health is such a great resource for that because it's accessible to everyone. And let's start with the most basic, which is micronutrient testing. You could do a comprehensive micronutrient panel such as SpectraCell, but you can also look at specific micronutrients because this sometimes can be easier to do with your primary care physician, for example. One of the most basics is looking at vitamin B12. This can be correlated with neurological and chronic pain issues. So looking at vitamin B12 in addition to something like homocysteine and or methylmalonic acid to get a better representation of your vitamin B12 levels. Of course, vitamin D. This is one of the most widespread deficiencies, especially in the US, and this is also associated with chronic pain. So this should be tested yearly without fail. Typically, vitamin D deficiencies are found in up to 60% of people with fibromyalgia. Of course, magnesium. This is best tested from red blood cells versus the serum level. And this is so important because it is necessary for over 700 different reactions in the body. And it is also associated with things like neurological conditions as well as chronic pain. We also want to think about ruling out other conditions, things like Epstein-Barr, Lyme, lupus, and other autoimmune diseases, for example. Looking at the GI map test or another comprehensive stool panel is so imperative. As we know, 70% of the immune system is in the gut. So when we can look at the gut from a potential inflammatory source, it can be so important. So is there dysbiosis and a parasitic infection, low secretory IgA or high secretory IgA, meaning what does the immune system look like in the gut? Do you have leaky gut? And so on. There's so many possible things that we can find from the GI map, especially looking at intestinal health. So how well you're able to digest your food, therefore potentially absorb the nutrients or not. So how can you work toward the path of healing for fibromyalgia? The first thing is to be able to work with a practitioner that is going to be able to help guide you to diagnose it properly, to find the underlying causes, and to be able to guide your treatment plan. As I mentioned earlier, one of the things that is associated with fibromyalgia is some type of emotional or physical trauma. So working with psychotherapy, somatic therapy, anything that is going to help you in a direction of addressing the emotional component of your healing can be very valuable. Additionally, of course, we want to think about our modifiable lifestyle factors. Optimizing sleep is number one because that is going to allow us to repair the body. And when you can begin to focus on that, although that might be very challenging at first because of the pain, because of the distress, there are ways to improve sleep over time with modifying different lifestyle factors. As it relates to movement, we want to think of a graded approach. So if you're experiencing chronic pain, then doing high intensity interval training is not going to be the most appropriate for your nervous system. So we want to think about grading it. So starting with walking for 5 minutes and then slowly moving up to 10 minutes and maybe 15 minutes to a reasonable amount where you feel good, you feel energized, and it's helping with mitochondrial function to help with pain sensitivity. But it is not something that's overloading your system that's really beginning to cause more and more pain. Trying to get sunlight, especially morning sunlight. So 20 minutes of natural sunlight within the first 20 minutes can be invaluable. It can help to increase your natural cortisol, but it can also help with melatonin production at night to really help you optimize your overall well-being. From a diet perspective, we want to think of a whole food, natural diet, emphasizing lean proteins. That is really important. Emphasizing omega-3s, especially coming from fatty fish. Optimizing fiber intake, at least 25 grams a day, and also emphasizing the diversity of your diet to really help with your microbiome. Also minimizing toxins, your cleaning chemicals, your facial products, things that you can potentially improve. You can check out the EWG website, Environmental Working Group, for a guide. There are also many supplements that you could begin to include. Of course, if you're treating a specific infection or you're addressing the gut, there can be very specific targeted supplements and in a phased approach that can help you heal your gut. If it's micronutrients, such as the ones that hopefully you would have tested, such as magnesium or vitamin D, those are all things that can be added to not only your diet, working on specific foods, but it can also be through supplementation. L-carnitine can also be very helpful in fibromyalgia with decreasing pain and also helping with mood and depression. Please know that no matter where you are on your journey with fibromyalgia, that there is hope and you can find the underlying causes of your fibromyalgia and chronic pain and begin a path to improved emotional, mental, and physical well-being. If you want more videos on root cause medicine, make sure you subscribe to our channel.